So good evening to all of you and welcome in this episode of Gyan Pravah. It is a visionary program of none other than but our dynamic president, Dr. Sunita Tandulwadkar madam. So as we all know, ma'am doesn't need any introduction. Ma'am is at present current president of Fogsi. Ma'am is the past president of IAG. Ma'am is the president-elect of ISAR and whatnot. Just to credit, ma'am has a lot of award in her credits, and definitely, ma'am is a first baby of stem cell at a age of 45 years. That is first in the world. So, and we all know the amount of work ma'am is doing for upliftment of the women's around across the India is really, really remarkable. Before I start and taking blessings from ma'am, to all the viewers, to all the Foxian, I just want to invite all of you in the Star Sampurna conference, and definitely it's a visionary conference of none than but our very own, very dynamic, the presidential conference Pune at the beautiful city at the Pune. I request all of you, please join. It has a full, package of, academics, package of, entertainment and whatnot. And, we all know how ma'am is organizing this and she is taking care of each and every topics, a full-fledged workshop and everything. So I request all of you, please join in this wonderful workshop of 14, 15 and 16th of November at Pune. So ma'am, before we start, I just want your blessings. Over to you, Sunita ma'am.
Thank you. Thank you, Apurva. You are really my darling chairperson. And let me tell you, Apurva, you are very sincere, very ethical, very honest, and very hardworking chairperson. The only chairperson who went through the Foxy website, which are the various awards, and where you can participate, may it be a publication, may it be your work, and you have done it. That shows your sincerity. You are practicing in a small East India, but the work what you do is larger than life. So thank you so much. Dr. Mai, how do I pronounce you? I think it's right.
Mei.
Mei.
Mei would be my first name,
Yeah.
and is my surname.
So, that's lovely. May I join for this podcast just to show the respect to the faculty who is coming to welcome them on the platform of Foxy. Foxy is our federation of 46,000 gynecologists, probably the largest organization of any OB/GYN in any single country. And we are blessed that 75 years of a history of this foundation and the amount of work our past presidents have done. So everything is so methodical. President works on one side with the vice presidents and 30 chairperson, and on one side the office bearers who look after the admin part. So it's a very well structured, and we have 292 societies, and these society presidents and secretary also join the hand in the organization. So it is very easy to transmit any work you wish to do easily with 292 societies because their presidents are connected with us. So we do a lot of program on women health and maternal health, and the work done by the past president always is continued. Plus we add on with your own vision for the year. So this podcast is one of our program for these 30 committee chairpersons. So on a 30 days, 30 people take the interview. It may be academic, non-academic, on social, spiritual, philosophical, political, any background, which will be of a great help to the viewers. Though it is on YouTube, anyone can view. We will give you the link also. You can collaborate with our Foxica. We will send you for a collaboration. इनको YouTube channel की link just send it Apurva, so she can collaborate and she can promote it in her city or in her country also. And that is that is the best way to move on. And I'm sure your podcast is going to be one of the best podcasts. I wish you all the best. And I joined the viewer link just to listen to both of you.
Thank you. Thank you
Thank
so much, ma'am. Ma'am, before that, Dr. Me is also a great fan of yours again. She sent me the picture of, Foxy 9 at Figo, and she told me, see, I clicked the picture of all of yours, and your president is so dynamic, and she organized such a beautiful, it is one of the best. So
It's my
thank
Exactly.
you so much.
I was hoping to meet Aprabha there, and then I was like, oh my God, this evening reception that was so dynamic. There were so many countries joining. It was like it really
larger than
shows
life. We always do
how
that.
far Foxy has reached, to all the different countries. And I've had the pleasure of actually working with like some of the Indian obstetricians and also like through the encounter within Wartok and Foxy as well. So I'm very grateful to get this invitation from both of you to actually join part of this and
Thank you. Thank you. I'm happy to
Thank
know
you.
that you
Thank you so much.
enjoyed. And I will be listening to both of you from the viewers link. Enjoy.
Absolutely. Thank you
all
so much,
right.
ma'am, for always being there,
Thank
for
you.
always your
Thank
blessings. Thank you. Thank you so much. So, my dear friends, this is my dear friend, Dr. Me, though I never met her personally, but through various channel, we get a very good relationship, and she is so dynamic and joined there from Ireland, and she is just immediate past Secretary General of WETOG. She is the chair of young sexual medicine scholar, and she is doing wonderful in that. Thank you so much, Dr. Me, for joining and for giving us the time. And today, when we are talking about the sexual problems, it's basically not only the sexual problems, but people doesn't know about the sexual rights. So and when as a gynecologist, we are actually have a lot of responsibility of giving the awareness to our patients. So, so this is today we are discussing, and just I want to know from Dr. Me also that what her views, what she is doing, and what the European countries are doing towards that. So, thank you so much, Dr. Me, for joining, and I welcome you. So, Dr. Me, when we are talking about, social or you can sexual justice, I just want to know from you what is actually the sexual and reproductive rights. Now, people are really very much confused, when they are thinking of about the sexual and reproductive rights, that what actually is contained. So, this is your first question. Yeah. That what's
So I
your view
think that
about the sexual and reproductive rights?
mm, so I think like to maybe summarize it a bit better for people to understand, I think we first need to kind of examine what exactly is reproductive and sexual health, even for the layman people and also for us clinicians. We're always taught that, within health, it means that, if let's say there is no disease, no disorders, that means that we're healthy. But that's not what reproductive and sexual well-being is about. It is sorry, sexual health is about. It's actually about the well-being itself. It means that people should be able to have safe, consensual, satisfying sex life, decide when and if they want to have children, to have the information to be able to make those decisions, and then also the services that's accessible that allows them to do that freely and also with respect and dignity. So you can see that all of these elements very much link to human rights itself. The right to have autonomy, to have informed choice, to equality. So, our role as gynecologists is more than just treating people for or preventing a disease, isn't it? It's also advocating for this right to be upheld. That's my opinion on it. I'm sure you shared the same idea as well from our conversations together. I feel that you share the same thoughts.
Absolutely, absolutely. So it is, we can't say a person to be healthy without having a good, sexual health. And sexual health doesn't mean to have an intercourse. Sexual health to means the free from STDs. They should be, have the accessibility of contraception. They have that much power to decide when to get pregnant. A couple should have a power to decide when to get pregnant, when to get rid of unwanted pregnancy, etc. So it's actually wide zone of variations, and it's not only that. So I am absolutely agree with you, Dr. Me. That's absolutely, when we're talking about sexual health, it is very important, and we can't say a person is healthy if he or he is not sexually healthy. So this is first question, absolutely. So when we are talking about the sexual and reproductive health, what are the different components? Though I think we already have discussed this thing, but what are basic, just one, two, three components, what according to you are there?
So I think a lot of times, like, and I think that's what I want to reframe for our listeners as well, is that when we think about reproductive and sexual health, we seem to think that, oh, these are just people who wants to have a family, who wants to have sex. And like you rightly say, it's not just that. And that's why I think that if we look at it, it's actually basically the health of a person, like from the moment they're born to, like, when they're aging and dying. So it really spans the entire lifespan, so it's from planning for the family. It's also trying not to have family, where contraception. It's about they're having a safe pregnancy. It's about preventing and managing STIs, and that can happen in pregnancy as well. It's being protected from sexual and gender-based violence. It's also about like menstrual, menopausal health, and importantly as well, something that's I don't think we focus as much into is about sexual function, dysfunction, pleasure. I think that's something that is not very much emphasized in our training and education. Yeah, so I think those are the different components. If you think about it, it's like the lifespan of being a woman or being a human.
Absolutely. So what I also I don't know about what the Ireland, that what's their views for LGBT. So in India, actually, it's definitely they doesn't recognize that, but it is not a crime in India. So according to Supreme Court of India. So I think when we are seeing a patient of that, their complaint should be not based on their orientation. This is also a component of the sexual and reproductive rights. If the
Absolutely.
patients of LGBT is also coming to, in your OPD, so they should getting a treatment of the similar thing what other people are getting, without their background, without their religion, without their socioeconomic status, without their orientation. So this is, I think it should be also included in the sexual and reproductive rights. So, Dr. Me, what's the status of Ireland and most of the European country regarding this same-sex relationship?
So in Ireland, it's great in the sense that same-sex couples are allowed to, they're allowed to get married. We passed a referendum a couple of years back to actually support that. We have a very inclusive, or moving towards a more inclusive society. But I think that we need to remain cognizant that this is not something we need to take for granted, because every day we do see even attacks here, towards people like this. And sometimes it can also be even just comments by healthcare workers where they are making little comments where it comes across as microaggressions. So it's what you rightly say, we don't have true sexual justice unless it includes everyone, regardless of their gender identity or sexual orientation. And this, those in the LGBTQ plus community, they need to get, undiscriminated services from us gynecologists as well. And even in countries like in Ireland and Europe, where I think the perception is that we're more open and more inclusive, I think that's not something we can take for granted, because at any point, these are all the rights that people can challenge. And that's why I think it's really important that, for example, my healthcare system, the HSE, the Health Service Executive in Ireland, we have a campaign to educate our fellow healthcare workers, hospital workers, about LGBTQ plus, what are their needs and priorities, and how to address them, including, using affirming languages, what are the difference, what are the impacts of hormones, surgeries, and just being respectful as well towards them during their interaction in the hospital, so they feel that they are truly welcome in a hospital setting, that they can come to us for any problems. So that's something that I think we need to constantly uphold, because it's it's not something everyone is as used to, and I think that's why it needs continuous awareness to make sure that this right is constantly upheld.
Absolutely, absolutely, Rakam, I fully agree with you, and definitely there is a view. Now, there's a problem is that now, because when we are talking about the country to country, or when we are talking about from continent to continent, the situation is absolutely varying. Whether it's a Europe, whether it's a Asia, whether it's a Southeast Asia, whether it's a Middle East, it is actually varying. For example, though I'm not going to in that politics, but few months, I think few days ago, the Afghanistan, the foreign minister came to India, and they have, when they are going to have a press release, so they don't want any female journalists to be present there. So actually, this is a variation from them, from country to country. So this is really very, I think, a very, very tough job when we are talking about, when we are talking about sexual rights, it's also about the contraceptive. Because, see the fertility rate of Afghanistan, see the fertility rate of other, Middle East country, and it's really had a very bad impact of the female. They are suffering from anemia. There is a lot of, maternal mortality, maternal morbidities are there, and criminal abortions are there. All the problems related to the abortions are there. So I think it is very tough. When we are talking about the probability is easier in a countries like Ireland or some European country, but it is a difficulty when we are talking about some Asian countries or some African or South African countries. So it is really difficult. So according to you, how we can actually make this difference? How we can make up
So
this difference?
maybe just to give an idea of my background. So although I am training and practicing in Ireland, I was born and brought up in Malaysia, so we also have a very similar culture as opposed to India and to the rest of the Asian countries. And I think that and to give context in Ireland, Ireland is a very Catholic country, and that has informed a lot of how it's practiced and the policies for many, many years. In fact, it wasn't until 2018, after many years of groups and individuals advocating for it, that we finally have abortion in Ireland. When I first started working in Ireland, there was definitely the atmosphere. I happened to start work in one of the it's known as the most Catholic region in Ireland, and I was told like never even to provide information, not even talk about abortion with the patients because it's a criminal thing. That's the why among the people there. And I was a young doctor, just after med school, that sort of way. So I think that the thing is, every country, like you rightly say, they have different cultural, different religious attitudes towards topics like contraception, abortion. Even now, when I'm talking to people about sexual pleasure as well, that all really shapes the access. But I think that the way to navigate that, and that's something I think we need to really do more. I don't think it's confrontation. It's not saying that what you're doing is wrong. Obviously, we have that idea, but it's also when you approach people in that way, when you're saying what you're doing is wrong, they are going to be, they will be turned off from actually discussing further with you. So it's a more collaborative kind of approach that I think we need to take. We need to understand, why do you think it's wrong? Is there some misunderstanding that has happened there? Is there something within your religious text that we can work together with? Is there, it's about respecting each other within, our cultural frameworks in order to actually promote the evidence-based care, create those, if let's say we identify that within this religion, within this culture, there is this concern. How do we find the evidence that makes it comfortable, make it safe for this group to actually then accept that this is something that is safe for their population, that it gives choice, it gives dignity, rather than something that's focused on morality. We're not really kind of arguing this is right or wrong, but it's just working together side by side, how we can bring this care safer to the population that we're working with. Because I think if we're looking at the core of it, they both, different factions, whichever sides that you're on, I think at the end of it, you care for the people, the patient, but the way that we work towards it, it's different. So how do we make sure those people are actually getting the care? They need to be at the core of what we do, not about fighting the different ways to do it. I think that would be my thoughts these days about this.
No, absolutely, it's correct. When you are talking about absolutely, let's be discussed. And what I think now, it is more on the religion part. That's the
Mm.
reason they are just not taking the contraceptive or not doing the abortions and all. It is more to the religion part than to the, because see, everybody wants, everybody knows. I think to create the awareness is really very important. Even many time when I am from a very small place, and the tribal populations are coming here. So even they don't know about, there is something known as contraception. There is something, some methods which is there, which we can have a difference between our two babies. So this is really very important to give an awareness, because people don't know about their own rights. Even they don't know, even they know that their rights, but they don't know how to implicate it and what are the different methods are there. So this is, I think, a very important, and when we are talking about to give and create abortion, awareness is really, really very important. So this is very important thing. Now, one more thing, Dr. Mee, I just want to ask from you, because you see, in our country, when we are talking about a lot of, I have had a podcast with some Asian kind of the person from Asia, AOFOC person, the FIGO person, and now from you as a talk. And they all is emphasis of one thing, that is the sexuality education. And unfortunately, probably India is among the first in the world which give the rights of abortion to our own people. And now we have, like in 1970s, we have implicated with that laws. We have the contraceptive. It's a government programs where we give information to the contraception and all. So, but unfortunately, even we are lacking behind this one thing, that is the sexuality education. So I just want to ask from you, it is really so important to give our youngsters to the high schools and to the college students about the sexuality education? So what your views?
I think we probably share the same views, I'm sure. As we start at the beginning, we talk about that sexual and reproductive rights isn't just about, like, having sex, about preventing people from getting pregnant, that sort of things, and sexual pleasure. It's more than just that. It's sexuality education. It's not just anatomy. It's teaching respect, consent, boundaries, empathy, all of the part of a healthy sexual and reproductive well-being. And we see that countries that implement sexuality education, like you rightly said, because they have the awareness, the education, we see a lower rates of teen pregnancy, STIs, sexual violence, because this was embedded in from young. And just like with anything else, like we learn to write, and even these days people learn to type, at a young age. So why not education about respecting ourselves, respecting people, about consent, about setting boundaries? Why shouldn't it start early? Absolutely, I think that as soon as they have the understanding, so about like what, 5 years old, 4 5 years old, it needs to, obviously, because just like different society, different culture, religion, you need to structure things according to how they will understand it. We need to do that at an age appropriate level as well. So I think it needs to start from, body autonomy, giving them the ownership, and then it evolves with their maturity in their thoughts to include things like contraception, consent, healthy relationships. And I think that the earlier we start, the stronger the foundation for them to be responsible. We're not giving this education for them to, we're trying to get them to prevent, teenage pregnancy, that's the things. It is essentially, but you want them to make an informed choice. That's the whole idea at the core of it. It's to be able to make a choice that you, at that time, with the knowledge that you have, that it's the right thing for you to do. And that's something that they have made the decision and not someone else have made the decision for them. I think that's what sexuality education is about, and that's why it needs to start early in all of it. And bringing that's still an issue even in Ireland. And I think a lot of times maybe when we think about Ireland, we think about that it is a predominantly white Caucasian society, but obviously religion itself, and also we have increasingly more immigrants as well. So it needs to be a sexuality education that covers all of it, that has the cultural sensitivity that is needed to actually make it acceptable to everyone. Because I have already heard that, some parents have opposed to education about LGBTQ plus embedded into the sexuality. But that's the thing. It's, you have to work together with those groups. It's like, well, why? This group exists. It's not that we're trying, the education is trying to turn anyone gay, that sort of way, It's about acknowledging that it exists. We just need to know more about them so we can be respectful. We can respect their boundaries, that there is education, give them an identity, the right to exist there, and the right to access care. So I think that this is something, I don't know how much, like you say, rightly so, you said in the 1970s have already been taught, but I think that with evolving times, we need to evolve our sexuality education. Interestingly, the education that a lot of the students still have in Ireland actually was based on a curriculum that was set in 1980s. So, these are the things that, just like we keep changing our curriculum for science, mathematics, language, whatever, this all needs to change as well. And if anything, change more, because the society is changing.
Absolutely. It's absolutely correct. And what we always, the problem is that now, again, when we're talking about the sexuality educations, we are getting a lot of, resistance from the parents, from the society, because they are thinking the sexuality education is about how to do sex. It's not like that. The horizon is beyond it. And definitely the countries like us, where we have a lots of teenage pregnancies are there, lots of criminal abortions are there, there's a lots of STDs are there. So I think it is need of the hour that every country should, implicate this in their basic syllabus, so that we teach our kids, we teach who's tomorrow who will be the adult one, that this is the things, and probably they will engage into the unsafe sex, which can lead to the STDs, the HIVs, and also the other things. So this will definitely prevent it. So I think the horizon of the sexuality education is much more what actually we are thinking, and definitely the impact is also very high when we are, applying the sexuality educations. So, Dr. Mee, you are also seated with VETOG. You were the office bearer of VETOG previously, and your representative from Europe to VETOG as a representative of VETOGs. So, what basically VETOGs is doing, I just want, because many, the youngsters, young gynecologists, they are thinking, we just passed it out, and what's our role in all these things? But what you thinking that what's a young gynecologist can do and what the VEDOC say is doing for the women health?
So I think that thanks for yes bringing up WATOC. So within WATOC, it is a young society, especially compared to like societies like Fogsi. Um, it is very much so Water collaborates a lot with FIGO, and within FIGO, the contraceptive sexual reproductive health, that is one of the committee that's part of it, and that they work on all these different issues about sexual rights, access, and that there's even a women's facing crisis group, so facing kind of like unsafe abortions, and even about like contraceptions for like access for example, marginalized groups, immigrants, sex workers, groups like this. So, in terms of what WATOC can do is that we provide the opportunity for young doctors or trainees, specialists to actually be part of this conversation. We would have like at the recent FIGO conference, we had a WATOC session that is specific to contraceptives and sexual reproductive health. Um, and within it, what we were discussing, for example, my topic was contraception for female sex workers. And my other colleagues from other countries was on talking about like contraception for in preventing gynecological cancer and then about unsafe abortion as well as about female genital mutilation. And I think that's like what you rightly say, it's about creating the awareness, creating the education as well. And not just for the public, but also clinicians, because as clinicians, even when we are what we call young or early in our training, we are basically the people who have that encountered that one shot with that patient to educate them and to dismantle some of the myths and misunderstanding that they have about certain concepts. So, and one of those things that I think we need to talk more about, in fact, even now bringing the Young Sexual Medicine Academy into it, which is the young chapter of the European Society of Sexual Medicine, is talking about sexual medicine. Because I think the other stuff we do remember to talk about them, but not so much about sexual function and dysfunction. And it needs to be as normal as it is discussing about blood pressure, for example. So in terms of what people can then do, I think that we need to just look about where we are right now in that setting, that interaction with that patient, is that you can already start by educating yourself and also that education that one-to-one. And that's why I am very grateful for your invitation to join this. Although I've never done a podcast before, I was like, I told myself this is something I must do because I see it that you have given me the platform, and that's what I would advise everyone else. If you've been given a platform with your patient, maybe with a patient group, with your society, accept it, challenge yourself, accept it, because that is our duty as a doctor to actually educate others, educating ourselves along the way as well, engaging in discussions like this, and also then being able to contribute and advocate for our patients. Talk to your patients, find out why they are, resistant to this, what their thoughts are, because that's the population we are servicing. We're trying to make sure they get access to our contraception, safe abortion, fertility care, inclusive care for all the different genders and sexualities. So that's what I think I always start with. I think that sometimes it can be very daunting to think that, oh, how can I join these different societies and things like that. I think without going into it too much, sometimes, so a lot of societies would have like a young chapter. There will be, have a platform for us to be part of it. But I'm sure you have the experience yourself. There is sometimes a little bit of a political thing involved with it as well. And so sometimes maybe as a young clinician, you feel that, oh, I'm too young, I don't have enough power for that. But no, I don't think that's the case. For example, my training is 8 years. That is many, many years of training as a doctor, of the interaction with patients. We can work within what we have, within our own community, educating our patients and our peers, our friends around us, so that they have the information and be able to advocate. I think that's what we all need to do. There's now increasingly more people who are speaking up on social media as well. One of my colleague, Sarah Murphy here in Ireland, she would start like a social media on Instagram, and I have seen so much of the work that she's put in, and that has really kind of come back to patients being just more informed about pregnancies, about different gynecological conditions. And I think a lot of the times as well, the other thing is that, and no one likes complaints, but I think we need to change the way we approach complaints. Like sometimes when patients come in, because now they know the information, they know how to advocate for themselves. And a lot of it now, they have the right information, which is great. And then they challenge the doctor, why can't you provide this and that? I love those kind of interaction. I have to admit, I find it quite scary and quite daunting. But now I see that because the patient is now able to advocate for themselves. Therefore, it works way more powerful if they could then, put the pressure on the government, on the Ministry of Health, on the hospital to provide better care for them. And that all starts from, from them having that education. That all starts from the doctors to ensure that they have the right education. So we are all in this together to try to improve care. So we need to include our patients. So to reframe what I just said, that was like, if we open our mind to all these complaints and take it as a way of feedback, as a way of actually them advocating for themselves, and therefore if we are listening to them, that also creates a better service. That's really all we need to do, really, rather than closing our mind off. And that's what I think we can do as individuals at any level.
Absolutely, absolutely. It's wonderful. So it was a wonderful discussion about the reproductive and sexual rights, and definitely we share the exchange from yours, from British point of view, from European point of view, and from Asian point of view. So it was wonderful discussion, and after that, because we have some time left. So why not, Dr. Mee, we will go into the core sexual medicine part. Okay,
The what?
like the core sexual medicine part, can we discuss some sexual dysfunction which you are getting in your day-to-day life? Okay, okay.
So,
So yeah, so
yeah, I
yeah,
suppose
yeah. Please go ahead.
within sexual functions, we will talk about, arousal, desire, pain, genital pelvic pain, and orgasm. And while we have started the conversation, or we have a little bit of education about sexual pain, even things about vaginismus, and with menopause health, we talk about desire. It's very little that we talk about within the components of it. And if we talk about it among clinicians, generally we would only think about what's the biological problems with it. When we look at a patient, examine them, we are only looking at like the biological parts. Is there any parts that is wrong? But the way that sexual medicine is that it's also it's not just acknowledging the biological part, but also the social, relational kind of factors to it. And that's something that's missing in a lot of our history taking. I fully acknowledge that it is I don't know how it is in India, but I think that you also have the challenge with your patient consultation time. You simply can't do this sometimes over one visit or even over 15 minutes. And
Absolutely.
that's always the challenge, because you're trying to provide this care to more people, but the quality of this, because some of these questions, it requires rapport with the patient to build the rapport, and that simply can't build over a short time or even one visit. And that's the thing in our focus that we don't focus enough about. That sometimes even things like pain, it's not just about like biological part. It's also about the other things, what has caused them. I think patients are now kind of more open to share if there's been any other sexual trauma about, like, their relationship with their partner. But it still takes some time to get that out of them as well and to explore. And it also requires the doctor to be open-minded to how different people have sex. For example, we think, and that's in our society, we think about monogamous sex, we think about like heterosexual sex, but there's also many variants of it. So it's to open our mind. And when we open our mind, I think that we give the vibe to the patients that we're open to hearing without any judgment. And that's the most important thing. So within sexual medicine, what we're trying to address is this concept as part of the implicit concept. But the first thing there is you give permission. So by doing this, you're giving the patient permission to actually share this with you. And it's only by knowing their problems, by them sharing, that we are even begin to solve what are the problems that's part of it. And then there's the other things about like understanding what is the normal sexual response like. I think a lot of the time we think that, oh yeah, just stimulate, it goes up, the curve, orgasm, that's it. I think that's what we understand. That's from like social media, from like books, what we understood, and also, but we know that when people have sexual problems, it works differently. So and these are concepts that have been going around for many years now, but it's just not, we just didn't have the awareness among clinicians, among gynecologists. It's not in our medical school studies, not in our training to even understand how a sexual response is. What are the different things that can affect it? And only now we're beginning to even think about like how menopause, how endometriosis is affecting like things like pain and desire. One thing that we don't think about enough, I think, is also what happens after having a baby. We all think that, oh, well, like if you've had no problem getting this, getting pregnant, that means that you have, after you can come back for your second, third, fourth, fifth baby. But within the work that we do, there's also, people who suffer birth trauma, and we don't talk enough about that, how that affects, and parenting. Parenting can be a bit traumatic, affects the relationship, a healthy relationship, and we don't have that service. Even within Ireland, not every there's only one hospital that, as far as I know, that would have a public psychosexual counselor. So there's not enough investment in this service. You can have access to private psychosexual counselors. It costs about 50 euros per session. And as we've just talked about, it's not just one session that you need. Sometimes it's more sessions that you need. And that's just the psychosexual part of it. When we're talking about like access to like medication, so one thing I have faced is that and now there's more emphasis about like, studying on people on vaginal estrogen, which is great. But there are also other medications where some people have vestibulodynia, and they may need medication that has the testosterone component. My colleagues in the USA have access to compounded pharmacies where they can make those medications that the clinicians want. I don't have that access here in Ireland, and that does restrict my practice. There is, like, for example, a medication called Intrarosa or prosterone that converts into both estrogen and testosterone. However, accessing that medication is not easy. It is not cheap. It is about 60, 70 euros per month, and you need that for 3 months. And it's not like I can import this medication from other European countries because it would be illegal, So that there's all these different frameworks that I think us as gynecologists, we can actually write to, for example, for me, I've been trying to get in touch with the company that produces, because they can then submit a request to have that included as part of the national drug payment scheme, so that it's more accessible to patients. not the best. It's not going to be free, but we're definitely making ways. For example, even when it comes to contraception, it is now free contraception that's being provided from the age of 17 to 35. Why it's not provided for people after 35, I don't completely know that. But I mean, previously it was up to 25 years, so at least now they have increased it. So I believe these things, just like when we come to limited resource like money, I know that it needs to be in stages, but it's also up to us as doctors. We are seeing the patients on the ground. We're able to inform policymakers, the politicians, what our patients need, what we need. Because yes, we do see ourselves as doctors. That is an added role, but we are also patients. You and I both have our sexual and reproductive rights as well. So we are also advocating for ourselves, when it comes to this. Sorry, I think I kind of brought like a whole kind of train trip around this. I could go on talking about this forever.
Yeah, absolutely. So, Dr. Me, what you have told now, it's a very practical thing. And probably who even we have in our mind that Europes are so much developed, probably these problems will not be faced by doctors or a patients from that side. But I think it's the same, whether it's a Asian country, whether it's a South Asian country, and whether it's a European country. And whatever problems you are saying, it is the same, almost the same which we are facing about the psychosexual counselor, about this problems about the medicine and etc. So absolutely, it's very true. And I think this is the best part of this podcast is it's a two-way. See, even in a lecture, you are just just seeing the PPTs and describing the fact. But in the podcast, we are actually having our own ideas and our own experiences and our own talks. So that's the things I think it's better for this poster. And that's why Dr. Sunita, Madam, our Foxy president, have started this initiative and with some topic, a particular topic for a particular day. So I think we have discussed a lot of things, and thank you so much. And probably this is really very fruitful to our all the viewers about the sexual rights, the reproductive rights, the LGBTs, etc. So thank you so much, Dr. Mee, for giving your precious time. And definitely in future also we will come with some very interesting and very beautiful topic, and we will discuss. And definitely it will be beneficial to our viewers. So thank you so much. And once again, I will really thankful to our very dynamic president, Dr. Sunita Tandulwadkar, madam, for this wonderful podcast series, the Gyan Pravah, which is really a wonderful initiative, and it's give a tremendous exposure not only to the viewers, but also we doctors also, because we are not used to of this podcast. So thank you so much, and thank you so much to the technical team and for providing us the technical part. So thank you so much, Dr. Me, and definitely I also welcome you in India for our upcoming conferences. If you at all possible, please do, and you will get the vibrant Foxy what we are. So thank you so much, thank you so much, thank you so
I
much.
want to say thank you very much as well again. Like it really is meaningful that Dr. Sunita thought about this, and for you for reaching out to me. And also, I know we've had some kind of scheduling issues, so I really appreciate how you can accommodate me as well in order to give me the platform to actually share my views. Like you say, with podcasts, this is where we share our opinions and things. So I'm very grateful, and thank you for including me as part of it. And I do hope to meet you at our many international meetings, perhaps also in India as well. I'm definitely due a visit back to India. I was there in 2018. And I told myself I have to go back. So why not for a
Oh, wow.
conference, right?
Thank you so much,
Thank you.
thank you so much, thank you so much, thank you.
Take care.
Okay, okay.